So we're here today to do a Facebook Live all about home birth for you all. I can't speak. Home birth for you all. So basically, I'll start with a few introductions. So for those of you that don't know me, my name is Olivia, and for the record, we're just laughing because somebody trying to creep out of the room very quietly because our remote wouldn't work. Sorry. Anyway, yes, so I'm Olivia, the creator and founder of Lotus Maternity, which is a range of nursing tops for women to help them discreetly breastfeed in public with confidence and complete discretion. Joining me today, this is Alice. So Alice is a midwife. Her and I trained. Sorry. Her and I trained together at the Uni of Nottingham, and she's a very dear friend of mine, bridesmaid at her wedding next year. And she works in the community as a midwife, so she does a lot of home births. And then we've got Sophie, who's my bestest pal, and she's pregnant, I'm sure some of you have guessed, nearly 33 weeks. And Sophie's a bit of a rarity in that she's having a home birth. And it's very, very uncommon for women, especially in their first pregnancy, to opt for a home birth. And in fact, it's only sort of 2% the national home birth rate altogether. So yeah, I thought it'd be nice to invite her along and we can pick her brains a bit and hopefully inform you all about home birth and why we think it's such a good thing, and hopefully you can learn a few bits from it. So just want to start really by saying why we're such advocates for it and why we really love home birth. So I think for me, like, I was very much sort of pro-normality in terms of midwifery anyway, and obviously we support breastfeeding and breastfeeding advocate, and they all tie really well in nicely together. And if I were to have children, my main reasoning for having a home birth would be, one, I wouldn't want the rigmarole of having to go into the hospital. Two, I want my own home comforts. I want the bottle of Prosecco in the fridge ready, pizza in the oven, and I want to be able to, once I've had the baby, sit down on my sofa, relax and just chill out. And I think as long as you are comfortable in your surroundings, that's going to be the best outcome in terms of how well your labour progresses. And what better surroundings and comfortable surroundings than your own home. What about you, Al? What's your sort of main rationale for why you love it and advocate it so much to women?
Very, very similar to you. I think biologically, you're as soon as you kind of bring the hospital in, you're in a different environment to your home. Your stress hormones can fight with the labour hormones. Your oxytocin levels can be affected. So being at home, generally, the women have a lovely, calm, relaxing home birth. From midwife's point of view, it's lovely as well because we don't get to do them very often, not as often as I would like. But it's you get 2 midwives generally, which obviously in hospital you're only getting 1. You're less at risk of intervention from you've not like kind of ticking time scale at home. As you know, obviously we have guidelines and things that we follow, but you've not got a doctor asking you about examinations every 4 hours or that kind of thing. So it's a much calmer, serene environment, I suppose.
Yeah, and we were just talking, weren't we, actually, about one you did recently. A couple had put a slideshow of all the photos. The husband had done it for her, hadn't he?
Yeah,
of all their trips and
mixtape and so you just can do it's your home. No one can tell you what to do in your own home. It's it's your
you can share it as well, can't you? I think if it were me and I had children, and they were older, it'd be nice to get them involved, or a dog.
The dog.
Whereas in the hospital, you've only got that option of two birthing partners, and that's it. And like Alice was saying, we find that so much. People ringing the hospital and saying, "Oh, my labour's going really, really well. I'm cracking on. Contracting 3 and 4 and 10. I really feel like it's happening. Can I come in?" And it's so common that as soon as they walk through their labour ward's doors, it all goes off. Like, all of a sudden their contractions seem to just like disappear, and it is to do with that stress hormone, because basically the cortisol's then stopping the oxytocin flowing, because it's a foreign environment, you know. Not most women, if they're healthy women, won't have spent a lot of time in hospital, and they're meeting all these doctors, these nurses they don't know. So until they then start to familiarise themselves with the setting, the staff, and then start to relax again, things will then pick up. So it just like, if you're having it at home, there's no interruption like that, and
you're more likely to get someone that you know as well. It doesn't always work out like that. But they are in the UK trying to bring that in a lot more with continuity of carer throughout kind of antenatal, intrapartum and postnatal periods. So that's coming in as well. Obviously it's difficult for us to be on call 24 hours a day, 7 days a week, but it's something that's being looked at to be trialled and brought in at the moment. So.
And why, Sophie? Obviously we've talked about why we love home birth, and obviously, like I said before, not many women, especially in the first place, choose to have a home birth. So what for you made you think, oh, I want to go for it and give it a shot?
Well, I think having you, obviously, as a best friend, like, you could give me, because I think there is a perception that it's less safe.
Yeah.
But obviously you have given me a lot of information about it. And I just think from stories as well, women like to tell you the horror stories of birth.
Yeah.
And I think actually I've only heard good stories about home birth. So, you know, that was a big thing for me as well, because I think going into the hospital, even just for scans, is quite stressful.
Yeah.
So that's why I found.
There's not many people that would say they like going into hospital
Yeah.
at all, is there?
No.
No, and I think it's that the journey, you know, that stress that you're already under, that, you know, I've got to get there fast. You don't have any of that. And what I was going to just say was about misconceptions that Sophie mentioned. So a lot of people all the time, you know, when I'm talking to women antenatally, I say, oh, so have you thought about a home birth? And they'll go, oh, God, no, I'm not having that. Because one of the main concerns is the safety of it all. And because they're like, what if something goes wrong, you know? And things do go wrong in obstetrics, you know, it happens. But I always say to them, the midwives aren't going to let you carry on if they think something's not right. If things are deviating from the norm, and the midwives thinking this isn't really progressing how it should, they're not going to like say, oh yeah, let's keep on at this home birth. They'll say, look,
more cautious.
You're more cautious than ever, aren't you? Because, you know, and you'll say, look, things aren't sort of going as we would hope. I think it's best that we transfer you in. So I don't think that
as well, if you're at home and you're labouring at home and you haven't thought about a home birth and you feel so comfortable in early labour, why then change that? Why?
Yeah.
You know, you're doing really well, so there's no point in suddenly making a big change to it. And then if you suddenly think later on in labour, oh, I don't really like this, I'd rather be at hospital. Exactly. Just because you're booked for home birth doesn't mean you have to give birth at home. It's maternal requests. It's not like it's the be all and end all. So why not just try?
Well, that's what you said, isn't it?
Yeah, I think if I was in the middle of nowhere and I was like miles and miles from a hospital, and you know it would take half an hour in an ambulance to get to a hospital, then maybe for my first I might not have considered it as much, just because, you know, there is
you don't know what's
going to happen, you don't know what to expect. But I think as well, like, whatever everybody says, like midwives, because people have been saying to me, oh, but you won't have doctors there, like, you know, doctors are the what, and I was like, yeah, but midwives
and the experts in normality,
looking after mum and baby, like they are the ones who know the most about birth. So if they think that you need to go into hospital, you know, they will tell you straight away.
Yeah, because that's where people get wrong. Like obstetricians, they are the experts in dealing with abnormality, and midwives are the experts in dealing with normal birth. You know, so as I say, you're not going to be less safe because there aren't doctors there. You know, you're in very capable hands, and like we were saying earlier, you got two for the price of one. And you know, in hospital, we are really understaffed, and sometimes you're not going to get that one-to-one care all the time because the midwife will be popping in and out. She'll have several patients to look after, and when you don't have that, you've got that personalised care and somebody there to hold your hand throughout.
Yeah, and that's what someone said to me today actually as well. They said, if you think about it, you know, when you're at home and you've got two midwives there, they're going to be with you all the time, like having monitored you for the whole time. They can't go far, they might go make a cup of tea or whatever, but they can't go far, they'll be seeing you constantly. Whereas in a hospital, if you're on your own for 50% of the time, it might take 10 minutes for the midwife to come in, then make a decision and then get a doctor, and then you have to wait for a doctor to come in and examine you anyway.
Yeah.
By which time, if you are at home and something, they're thinking, oh, you know, it might be best for us to go into hospital, you could be looking at a similar time frame anyway. Yeah. So.
Yeah. And another one that we get, as I say, people turn their nose up is, oh, well, it's not going to be very clean. I don't want all the mess. But the midwives won't just leave all the mess and everything.
Very tidy. We don't make any mess at all.
Yeah, my next door neighbour had a home birth, and she said within an hour, she was sitting on the sofa having a cup of tea, and the midwives had tidied up everything.
Yeah.
And she was like, you know, obviously they're not cleaners, but they like literally will do everything they can to leave it. You know,
some old shower curtains or bin bags, that's all we need.
Oh yeah, just some like cheap sort of sheets from Primark or something that you're not bothered about having, you just throw them away after. And especially if you're having it in a pool, they're not going to be much mess anyway.
No.
So yeah, there are a couple of things that like I just wanted to address, because a lot of people, that's their rationale for why they don't want a home birth. It's often those two things. Well, what if something goes wrong, or what? I don't want to be left with all the mess, etc. So just on the flip side, thinking of why people may prefer the hospital. So a lot of women like the idea of that support overnight, even though obviously in labour you're getting better one-to-one support in the home birth setting. Obviously if you go to hospital you can stay on the postnatal ward and have midwives there and maternity support workers to help you with breastfeeding and things like that, or you've just had baby, it's a massive change. So that would be maybe one reason why people would choose the hospital setting. But at the same time, if you have had a home birth and you're struggling with feeding overnight, there's nothing stopping you picking up the phone to ring Labour Suite and say, oh look, I'm having a bit of issue with my feeding, baby's struggling to latch on, or I'm not sure about this down below, whatever the question may be. And if they think, oh, maybe you should come in, you're not. Yeah. It's not like the hospital is not welcome to you if you've had a home birth, and you can still access that support. And midwives come out to you the first day after you have had a home birth, isn't it? They come the same day after.
Yeah, I was going to say, you probably ring the community midwives before you ring the hospital, because we'd just come out to you. It's almost, obviously if it was in the night time we wouldn't, but yeah, we'd come out to you the next day and just give you feeding support or whatever you wanted, really. We do come the next day though.
Yeah, so as I say, I mean, there's arguments for the both sides, but I don't want people to think that because they've had a birth at home they can't access that support round the clock as you can in a hospital.
The biggest complaint I get though about staying in overnight is everyone else's baby's crying.
Yeah. And that's it, isn't it? Because you'll be shattered anyway. Your baby's asleep, you've fed it, everything, and then the baby's in the next phase. Start crying, and it's not very restful. And I think it's a privacy thing as well for me. Like where I trained, we had combining toilets, so it was shared bathroom between the two adjoining rooms. So obviously you lock it when you were in it, but a lady could have just gone into the shower, having had a birth, and then the lady next door might be in early labour, and she can't then access the toilet because she's in the shower, or it's just you don't have that if you're in your own house, because you don't you just don't have that. And so there is, to say, big reasons why we love them. Have you sort of got any questions that you can think of, Sophie, in terms of a first-time mum, things that you worry about with a home birth, or things that you're not so sure of? Because obviously you've not yet had your home birth visit with the midwife. You'll have that next week, but
so probably just, I don't really know timings. So when would you ring the community midwives, and when would they come out to you? It's kind of like, how long would they leave it? Because I know that a lot of people have said to me with home births as well, they progress a lot quicker. So my worry would be maybe that I might be further along than what might be typical. And my partner would not be of any use at all in helping to deliver a baby. So it'd be down to me and the dog.
It's a good question, and it's the same assessment that we would give to anybody. You'd judge it over the phone, wouldn't you?
I said
and
to
take
my
a history.
home birth, it's always better to ring this just to let us know, even if you're niggling.
Yeah.
Because then we know about you. We know you're a potential home birth that could be going, you know, that need us in the next even 24 hours. You might not need us straight away.
Yeah.
But generally with first babies, you want you to be having regular contractions, kind of 3 every 10 minutes before you ring, or if your water's got, obviously we need to know about that as well.
Yeah.
But yeah, I would ring earlier rather than later.
Yeah.
Don't feel like you're annoying us.
Okay.
Yeah, just keep ringing.
Get you round.
Yeah, just keep ringing.
And also with thinking about having a water birth.
Yeah.
So obviously you told me a bit of information about where to kind of get the pull from. But you know, I think there's always the thing of when you're in a hospital and you're having a water birth, because you're in that kind of clean environment anyway, and obviously home will be clean, but you know, my other half I know definitely has reservations about what happens if something goes wrong in the pool, or you know, you have a little accident. Who's going to sort that out?
So like midwives do that. We do, if you do happen to poo in the pool,
Yeah,
That's what
you
I was
have
trying to say.
there's a little sieve,
Little
you know,
sieve.
and you sieve it out, just as we would do as a pool birth in the hospital. And like midwives are very good at being discreet, and it's actually better if it happens in the pool, in my opinion, because it's not the same smell, you know,
Yeah.
as it would be if you're
It's much
on the
easier
bed,
to-
and it's easier to just
yeah,
sieve
scoop
out.
Yeah.
And I get asked that a lot actually about like the cleanliness of when you're having a pool labour.
Yeah.
And I said it's not the mess on delivery. Like the mess, I don't think when you have a
No.
pool birth, it comes like, you know, people think there's going to be bloody water and horrible, because most of the blood comes at placental delivery, which is done out of the pool. So when you're actually having a pool birth, you know, at home and
Probably
you're worried
didn't
about, oh, what if they see this and it's minging. At delivery, it's mainly
No.
water, and likewise.
And afterwards,
so
you're not going to be looking at anything but your beautiful baby.
Yeah.
So we'll be looking at the everything else and the baby.
I
Yeah.
guarantee my other half will spot it if it's there.
But at least
midwives
Mrs.
will be there to
True,
go.
he doesn't miss the
You
True.
know.
Yeah.
It's fine, it's normal.
Yeah. It's fine.
Scoop it up and take it away.
Yeah. You won't poo afterwards.
Yeah.
Just drawing.
Just
Yeah. Maybe.
It's a good thing. It shows that you're getting close.
the head's pushing it out.
Nice rectal pressure, yeah.
Yeah.
And on that note, we're gonna go. Okay, lovely. Right. We'll see you in a couple of weeks.